Life in the hospital is hard. Life waiting for test results, waiting for your child to wake up from surgery, not being able to hold your child because of a procedure. My husband, Andy, and I had Kate in 2006. Unfortunately, we soon found out that she had a heart defect. Kate passed in 2008, and we were just left thinking, how do we keep her memory alive? How do we go on? How do we make other people's lives better because of Kate? Leave a legacy for her. So we decided to do Kate's Cart, and we decided because books were such a powerful healing tool for Kate that we would utilize books and that we would give books to kids in the hospital. There were 30 days when I couldn't hold Kate, and the only way that we could bond with our 3-month-old was through books and reading with her. So we started our first cart in 2008, just a few months after she passed. The community rallied behind us. Family, friends, strangers heard about it, and within 3 years we were at 10 hospitals. It's been 15 years now. We service 22 hospitals. We're throughout the entire Parkview Health System. 37 carts are out there with a brand new book just waiting to bring a smile to a hospitalized child.
Every time that Kate's Cart pushed their little pink cart down the hallway, it really brought joy. When Marlena was born a little over 10 years ago, her heart rate was very low. So as we took this week-long adventure in the NICU at Parkview Regional Medical Center, Kate's Cart visited us every day and gave us books and made sure that we had everything that we needed to be able to read to our newborn as she recovered.
We're really about bringing comforting diversion to the child, and that's done by these popular, well-known, loved characters that are in books that just open a whole new world to the child. So instead of thinking about an upcoming procedure or the pain they're in, the surgery that they're having, who are all these strangers? They're like Anna and Elsa, you know? And all of a sudden they're transformed to Princess Land, or they're checking facts on their favorite sports player. And just whatever happening in the hospital has now been transformed to this book that they have.
When I was growing up, my mom read a book to me, at least one book every day, and especially at bedtime. And I envisioned that as a parent with my children as well. And so when we received a Kate's Cart book every day while we were in the NICU, it did present kind of this state of normalcy as we were able to read a story to our newborn, knowing that she wouldn't understand the story, but to be able to hear our voices and be able to bond with her in that way, and just really kind of starting out her life as a reader. And she absolutely loves to read and loves the library and has a million books in her room now, falls asleep reading every night. So I would like to think that a part of that was due to reading to her at a young age.
If I had to sum up the success of Kate's Cart, it would be that my baby girl's life has a purpose, and that there's a legacy, and that she hasn't been forgotten. So many times parents and friends will ask you, how many kids do you have? And I can say, I've got 2 healthy boys, but let me tell you the story about Kate and how the community of Northeast Indiana has rallied together to create this legacy with 100 volunteers, countless donors, hospital staff who are just a part of it and a part of making the hospital experience a little bit brighter. It just makes my heart happy.